interviewing Dr. Leo Galland right now, who is both a doctor and internist, as well as a patient of Shmuel Tatz, who is the centerpiece of this show. So you can learn a little bit about the kind of work that Shmuel Tatz has been doing for many years as a trained Russian physical therapist. And having come to this country years ago, has been working on a range of people of many different professions. And Dr. Galland was kind enough to let us speak with him about some of the problems that he has had that Mr. Tatz has been able to effectively treat. So welcome to the show, Dr. Galland.
Thanks, it's nice to be here.
Good, well, welcome to have you. First of all, could you just give a little bit of background about yourself that you could share with the audience so they know about your own medical background?
Okay. Well, I'm an internist. My present practice involves internal medicine, also pediatrics, and nutritional medicine. And I basically work with people who have difficult, kind of complex problems that have failed to resolve with conventional and many often non-conventional attempts at intervention.
So you use conventional as well as herbs, food, nutrition?
Yeah, I use anything that seems appropriate and that seems to work.
Excellent. Excellent. Now, why is it, and also you are the author of a book.
I wrote a book called Superimmunity for Kids. It's was published a few years ago by Delta.
Excellent. Okay, good. We'd like to talk with you on another occasion about that, because I think there are a lot of people in the audience who could benefit from knowing about that kind of information.
Well, it's about nutrition as it relates to the developing immune system in children.
Good. A very important and salient topic these days. What is it that brought you to Shmuel Tatz in the first place?
Well, I had two kinds of problems. I've dislocated both of my shoulders, sports injuries in the past, long time ago.
I see.
Right shoulder playing football in high school, and the left shoulder skiing about 10 or 11 years ago. And the left shoulder in particular just was giving me a lot of difficulty in the course of swimming in particular. And Shmuel was just amazing with the way that he mobilized the adhesions that were present.
So there had been scar tissue that had been...
Oh, there had been a lot of scarring. In fact, some of that I had allowed to form on purpose, because when I dislocated, it was a pretty complete dislocation. The orthopedist said to me, well, there's a 50% chance that this is going to come back unless it really scars down well. So for 6 weeks, I didn't move my arm. I just
kept it... You mean that it would become dislocated again?
Yes, right, because in my right shoulder, what had happened after the initial one was I would get recurrent dislocations if I were playing basketball or something like that, and they are not fun. So I had kept my arm strapped to my chest for 6 weeks. In fact, when I finally tried to move it, I couldn't move it. It was totally frozen. And that, as Shmuel said, that's the time when I should have come to him. That would have been the time to really to have him mobilize it. Instead, I did more routine physical therapy and tried to mobilize it myself and got a fair range of motion in there. But there's something called an impingement syndrome in the shoulder, in which the nerve often gets trapped within the joint and within the scar tissue, and I can get a fair amount of pain and some weakness. I began to notice that it was really troubling me when I was swimming in heavy surf. So I figured I better get this taken care of.
So, but it's been, it became a chronic problem. And
oh, yeah.
It happened 10 or 11 years ago.
Yes, yeah, it's chronic but very subtle. You know, if you're not, I mean, in the course of my ordinary activities, I wouldn't notice it. When I start doing something that's physical and strenuous, all of a sudden I notice that I don't have the reserves, I don't have the function that I remember I used to have.
Yes. Yes, thank God for memory.
Yeah, right. Well, and you know, and it doesn't really hit you until you get into a situation where you really need it.
Right. So when did you start to see Shmuel?
Oh, just a few months ago.
Oh, so
yeah, I just started.
All of this time.
Yeah, after a long time.
Yes. And so within a few months, specifically, what has occurred?
Oh, well, with regard to the shoulder, it really only took a few treatments, and the mobility of the shoulder improved dramatically. I mean, he did things to me that I thought were really weird and crazy, which no one had ever done.
Such as?
Moving it. I mean, very it's hard, very vigorous movements of the shoulder. I mean, I felt like I was rattling, but afterwards it would really open up.
It got limbered up and.
Right, but he's different. I had another problem which he dealt with also, which had come on very acutely, which was TMJ pain. And he had a very different approach to that. That was not vigorous. That was very gentle. He used shortwave diathermy to relax the muscles. And I was very impressed with the range of approaches that he brought to different problems. The time and the reason that I wound up seeing him was my wife had ruptured a disc in her back. And that was the first reason I went to Shmuel. When I saw what he was doing with her, I said, gee, I better see him myself.
I see. And what happened with her?
Well, she's well. I mean, she is much, much better.
Had she had surgery?
No. Surgery was avoided.
Surgery as a result of this.
Yeah. Well, there were several things that were done that allowed her to avoid surgery. I don't think most people who have ruptured discs need surgery. Pain control is really the issue because it'll heal over time, and then there's a lot that needs to be done to prevent it from happening again.
So Shmuel was first successful with her. And
yes. Oh yeah.
Disc.
Right.
And that enticed you, basically.
Yes. It usually happens like that. You know, the women go in first, test out the water, and then the men follow.
I think they're braver than us, don't you?
Yes.
Yeah. Well, that's wonderful.
Yeah, they have more faith and confidence also.
Yeah, right. In the alternative, right. So you're very glad that you went to Shmuel.
Oh yeah.
Feel that.
Oh yeah. I've referred several patients to him since then. And the reports that I've gotten from them have all been very good. And people with acute sciatica, headache, chronic headaches, shoulder pain.
Well, you know, the Russian system of physical therapy, how they teach it there is very different than what we do here. And this is what I've learned from him. And it seems a lot more thorough and complete. And they're willing to take risks, like when you were talking about the vigorous movement. That's something I've never seen a physical therapist do in this country.
Well, I think it takes a lot of confidence. I mean, I wouldn't want anybody doing it to me.
Wow.
He really knew what he was doing. He knew exactly how far he could go.
Right. Which means he knows anatomy and physiology better than your average physical therapist here, or maybe even orthopedist for that matter.
And also that his hands are really good, and that he knows how to feel what he's doing with his hands. In fact, I think the words he used to me were, I diagnose with my hands.
I see. Well, wonderful. I appreciate very much your taking the time out and giving us this.
I want to ask him, in that sense, would you say he's like non-Western in approach? I mean, is there something else happening there?
Well, I think there's that also. But what he meant, I think, when he said, I diagnose with my hands, is that he's actually feeling the tissues and he's feeling the physical resistance. Above and beyond that, there is something energetic that Shmuel does and that Shmuel responds to. It's not purely feeling the resistance of the tissues. He is definitely responding on another level. That's not necessarily non-Western.
But how do you explain that as a Western doctor? How can you?
Well, there's a long tradition throughout the world of people using their hands to heal and also to feel energy.
But the AMA doesn't recognize it.
Well, okay, it's certainly not conventional, and most physical therapists don't have a clue about it. Many people who use their hands on patients don't have a clue about it, but it's there, and it happens in all interactions, just the same way that a placebo response occurs or transference occurs. Those things are there, they're just not noticed by people who are blind to them.
Is there any way you can integrate it as a Western doctor and also being aware of this? Is there some kind of bridge that you can make?
Oh, I don't think it's hard to bridge at all. The question is what modalities you're using. I don't work with my hands. I basically work by talking to people. And in the course of talking to people, I respond intuitively to people, and I also am communicating to them in such a way that they're responding to me intuitively. So there is the conversation. Yes, we're talking about the diet and the nutritional supplements, but there's a great deal more going on. And it goes on whether we recognize that it does or not. I try to maintain an awareness of it, and where it's appropriate, I try to point it out.
There's a therapeutic value in relationship and in intercourse, really.
Mm-hmm.
And in fact, it's interesting because Shmuel really emphasizes, in my experience, the physical part of the relationship. And the dialogue is primarily through the hands.
Yes.
Through the body, and non-verbal. And it's interesting because it has a tremendous impact, as does, no doubt, the work that you do. And I know my work as a psychotherapist is primarily interactive and linguistic. It's not by touch, even though I have a whole other practice involved in that. It's a different kind of communication, both valid and both effective. Anyway.
Is that something that could be, what I'm getting at, it's something that's not recognized in medical schools or taught. Do you think it's possible in the future that that will be?
Oh, I think it definitely will be. And it will be in a variety of ways.
How?
The way it's going to enter into medicine, since doctors do not do very much that's therapeutic with their hands that in a conscious fashion, the way that it will enter into medical education and training is by the focus on the relationship that exists between a physician and a patient. And that has already started to sneak into the curriculum of medical schools. And I think it's going to grow.
Bedside manner.
Right. Well, courses in the art of medicine and interviewing and communication with patients. And I think that emphasis is going to grow because, without a doubt, the most important component of the healthcare system is the interaction between the patient and whoever is providing the health care.
Mm-hmm.
It's more important than any other single part by a long shot. In nursing, the notion of therapeutic touch has already had quite an impact.
Sure.
And also stirred up a backlash.
Right.
In what sense?
Oh, there are people who have decided that therapeutic touch is not scientific, that it's voodoo, and that it should not be included in the nursing curriculum.
How much, since we're on the subject, how much of medicine, in your observation, going from medical school and on, is scientific?
Well, it's not just my opinion, but this question has been answered by studies that have been done, and somewhere between 15 and 20% of what physicians do has been subject to validation by the methods of science and survived that. So 80 to 85% has not been. And most of it probably never will be, and it might not even be possible to do it.
So that's the irony, isn't it? Because there's this notion that Western medicine is scientifically based.
Right, it's a mirage. It's a mirage.
Yeah.
And the difference between, the fundamental difference between alternative medicines or alternative approaches and Western medicine has nothing to do with science, because Western medicine has relatively little to do with science.
Mm-hmm.
It has to do with the way that sickness is understood. And the fundamental tenet of Western medicine is that sickness exists because people contract diseases, and that diseases exist as entities which can be described independent of the individuals who harbor them. All other systems of medicine, whether we're talking about traditional Chinese medicine, ancient Egyptian medicine, tribal healing in Africa or among Native Americans, or for that matter some of the more recent alternatives such as chiropractic, view disease as an event that occurs in the life of an individual which is produced by disharmonies, imbalances, and pernicious external influences or traumas. The thing that is so sad and disturbing is that the tremendous database of biological and behavioral science, which is claimed by Western medicine, actually supports the biographical understanding of disease. That in fact diseases do not exist as separate, distinct entities.
Entities of themselves.
That's right, that they are reflections of disharmonies and imbalances and pernicious influences, and that it is possible to begin to describe those scientifically.
I think that's right on point.
That
It
is a
really
good-
is the difference between the systems. One is treating diseases as things themselves, and so remedies will be based on diseases, as opposed to a human being interacting in an environment with his or her own personal constitution, and they will be expressing various kinds of imbalances in a unique way.
Right, and so the biggest problem that emerges in treatment practice in medicine is the conflict between treating the patient and treating the disease. And all sorts of false distinctions between what's physical and what's mental appear.
True again. Yeah.
And the question isn't even a valid one as soon as you change the paradigm.
That's right.
So the question is again, how is that going to happen, and when is it going to happen?
It's going to happen because the present system is already beginning to disintegrate and deteriorate. You know, the concept of disease emerged, of diseases as entities, first really emerged in the 17th century. It took about 200 years before it begun to take over the practice of medicine, and that primarily happened in the 19th century. Especially with the discovery that there were microbes associated with different diseases, and so the belief occurred that each disease had a particular cause. You know, there was malaria, which was caused by this particular
different
parasite. Right, well, if not a germ, some other individual factor. That's been resisted by elements within the profession for the past 100 years or more. But eventually it began to triumph. And it was useful to a point. That is, there are particular tactical arenas in which this perspective was useful. But the number of arenas in which it's useful is shrinking. And especially as antibiotics become less and less useful to us, a different way of thinking about infectious diseases, which were the entities that launched the whole business, has to emerge.
Right.
And the whole issue of autoimmune diseases, which is a whole new field in a way.
That's right. And really, the autoimmune diseases, in fact, are an important bridgehead to changing the paradigm. Because there is, that's an area in which the conventional paradigm really begins to break down.
Yeah. And they have to recognize it at some point.
Yeah, it's happening. It'll probably take another 50 years.
Yeah. Well, the article that was written in the New England Journal of Medicine showing that there is a vastly increased number of people of the American population that are seeking out alternative care, I think alarmed the powers that be in the medical profession, the AMA and the pharmaceutical industry, and realized that there really is a changeover in the general status of a physician in the society, and that standard medical care is really no longer serving its avowed purpose, and that changes have to take place because the public is demanding it.
Also, yeah, and I think that managed care is going to actually make that change come about faster, although that's not recognized by the people who are responsible for managed care. But either of two things will happen. In one managed care scenario, what happens is the old model is rigidly clung to, which is the way it mostly is done, and as a result there are going to be increasing numbers of people who find that they can't get their problems dealt with within the system. And so more and more people are going to have to go outside the system. because the physicians, they don't even get the time with the physician. They don't get the personal attention. It's all, what disease do you have? This is the treatment for that disease. The other model of managed care, which is emerging in some places where there are more seasoned HMOs, is one in which the physicians are rated by the patients based upon questions like, did you have all your questions answered? Well, as soon as that begins to happen, that also enhances the paradigm. And that doesn't necessarily shift people outside the system. It begins to change the behavior of physicians.
Mm-hmm. Right. And that might be the way that the door begins to open more to considering the doctor-patient relationship from another perspective, and the importance of including what we now call alternative treatment.
Do you feel you're working from the inside, like a kind of double agent? Or?
Well, I'm not very much inside. I'm not very much inside, but I am really interested in bringing the kinds of ideas that I've just discussed with you into the mainstream. Mm-hmm. Most of my teaching has been among physicians who are already committed to alternative approaches. But I'm really interested in bringing some of these insights into the mainstream. Mm-hmm. Not really as a double agent. I mean, what I'm doing is going to be pretty upfront and overt.
Mm-hmm. How are you going to do this?
Through workshops, articles, writing.
Like Bernie Siegel, in a way that he's done it.
Bernie's model is not a bad one.
Yeah.
I mean, that would be a nice one to be able to follow, actually.
Yeah, really. Love for all. Well, thank you very much again, Dr. Galland, for being on the show.
Okay, it was nice talking to you.
Good.
Bye.
Okay.